putting up. Thank you. Thank you all for introducing yourselves. I'm going to start sharing my screen and we'll jump into a couple slides and talk about the agenda for our shorter time together this morning at the January code meeting. So let's see. Can you all see the slideshow? Okay, little thumbs up. Awesome. Okay, so our time together this morning, we're hoping to do a quick kind of check-in and feedback on the COAT meetings and process so far. We'd love to get some ideas for future topics, areas we haven't necessarily focused on the past couple of months that feel pressing or important to folks. And we're also going to, with special guests Monty and Dora, have a quick presentation and conversation about child health and well-being data in the most recent State of Vermont's Children Report. And then finally, we're going to spend a little bit longer than normal talking about updates and announcements. We have kind of a new process at BVF that we'd like to share regarding how we are ensuring that things we're hearing within the BVF network are kind of circled up to the folks who need to hear them. And then also would really love to hear what folks are monitoring during the legislative session or any other important updates or things to share with this group. So with that, I would love folks to kind of quickly take a look and remind ourselves of the committee's charge as we turn to a Jamboard and start thinking about, what is currently working well within this charge for COAT, what is working well about these meetings, and what are components or guests or other topics that we feel like COAT needs to dive deeper into. So I will ask someone on my team to enter into the chat the link to the Jamboard that I sent ahead of time. It was also in the email and in the agenda. Some folks might already have it open. But if folks could join us in the Jamboard, that would be perfect. And I will kind of stop sharing my screen and switch over to sharing the Jamboard. So bear with me for one moment. Okay, awesome. So you can see a bunch of folks have joined. I'll give people another minute or two. And we're just gonna kind of cycle through a series of questions. I'm sure most of folks have done some type of Jamboard or virtual board kind of thing at this point of the pandemic and of virtual meetings. But essentially I'm gonna cycle through a couple of questions and give folks the opportunity to throw up some sticky notes onto our boards here, but also would love to hear, either in the chat or feel free to unmute and share kind of what you're thinking about each of these questions. So the first is, what do you like or think is currently working well for the Child Outcomes Accountability Team? So this could be, a recent meeting that you appreciated the content of. This could be something regarding like the process in which we meet as a committee, or how we share notes, or it could be anything related to how COAT is currently functioning, but something you appreciate about COAT as it currently stands. So as a reminder, over here on this side, this is the little sticky note function, and you can choose your color and kind of just pop it up there. So feel free to get started with that.
And it looks like it's only in view access. I don't know if you can change the view setting.
Interesting. Okay. There we go. Sorry about that, folks. Does anyone want? Sorry, go ahead.
Great. I was just acknowledging that worked. So
okay. Thank you, Danielle. While folks are thinking and typing, I imagine, does anyone have anything they want to share out loud?
This is Charlotte. It's not a big deal, but it's still in view only for me. Maybe I just need to refresh.
Yeah, try refreshing. That seemed to work. And if not, if you want to post something to the chat, I can add it.
Yeah, this is Michelle. I had to refresh.
All right, getting some great feedback here. The diversity of members, great mix of people, cross-sector dialogue about big topics that have a real impact, kind of the cadence of the meetings, so monthly meetings. That's kind of a similar one right there. Okay, these are great. So we're kind of hearing things in a couple of buckets related to membership, the cadence of the meetings, the content of our conversations. Rich cross-sector dialogue, typically feels topical, which is something I think we'll kind of talk about later in terms of what people, trying to get a better pulse on what everyone in their respective organizations is monitoring right now, so we can continue to make sure that it feels topical. Guest presenters, appreciate the cross-sector sharing of data. Well-organized meetings. Jen as a parent leader to participate, it's a great point. Okay, these are great. Thank you all. Really appreciate this. Does anyone have anything that they shared that they want to elaborate on or elevate before we move on to the next question? Having this forum and space to discuss data and how it can inform the system, another great one. Okay, feel free to unmute, but I'm going to move on to the next question. Okay. So the next question is, what can we do to improve within the child outcomes accountability team? So kind of with all those positive things that we know we want to keep implementing, to keep doing, and to keep, if anything, doing better and leaning into, what comes to mind that could be improved within our committee structure, topics, things of that nature?
I really appreciate folks recognizing that this is definitely a more process heavy meeting for us, right? It's not diving into those concrete topic areas just yet, but the things that are shared about how we not just within this committee, but across the board in the BBF network can improve are really the critical components of what allow us to do our work well, right? So some of those things that we've heard from folks is, okay, well, a lot of the work that you do behind the scenes is unseen. How do we think about that communication strategy? How do we think about letting folks know how we are elevating the challenges and issues we hear during these meetings, through regional councils, through our Families and Communities Committee and family ambassadors? So really interested and wanting you to provide some concrete feedback in this area as well.
These are great. So more direction around, we have a great, rich, data-oriented discussion, kind of what is the what next? What do we need members to walk away with and do? It's a great point. A written intro and document to help orient new members. That's a really interesting point and kind of something we've been exploring in other committees. And definitely, I think Jen could help us with this a lot in terms of her experience with families and communities and thinking about this right now. But I really appreciate that point. Shared strategic focus, more family and direct service provider voices. Great group, and who else should be here? That's an excellent one as well. I think either the next or the last question will kind of ask folks for feedback on who is missing currently from COAT. Happy to connect more families with this team. That's great. These are really helpful. And to Morgan's point, a really important part of our work. So I appreciate everyone sharing, especially this early in the morning. Again, I'll kind of ask, does anyone want to elaborate on anything they've shared here or something that someone else shared that really sticks out to them?
This is Cynthia, and I'm having similar, I think, thoughts to a lot of these comments. And this committee, its charge is so broad within the early childhood system that sometimes it feels like we get a lot of really great information and we have great presentations and there's so much information, but to the point of how do we prioritize it for actual action? How do we, I think, as committee members walk away feeling like we've also accomplished something, not just met and had really great discussions for our own knowledge, but then we've actually turned that into systems change. And I think that's the one piece that I struggle with, at least with this committee, because it's so big in terms of topics, not people, but topic areas.
That's a great point. Thank you, Cynthia.
So, it's Kaya, and I'm the one who put the intro for new members because this is my second meeting, and I love the idea of looking at data, but I think being oriented to what we're doing would be helpful so that I could actually be helpful myself. And I'm also the one who put in the comment about IDEA and centering inclusivity, diversity, equity, and accessibility. Simply because I know it's hard in the state, because gathering data is hard because of concerns of confidentiality and things like that, and identifying people. So it's just something I'm always harping on.
That's really great feedback. And I appreciate you calling out both those points as a new member and someone really thinking about inclusivity. So thank you. I think Pam, did you have your hand raised? Do you have a thought on this?
Did. I was just going to follow up on what Cynthia said, and also to someone else's comment about being happy to connect families. I think I would be happy to connect families to our group if it was clear about how we were utilizing their voices and their time, what impact that makes, because I also feel that we get great information and we certainly are digging into some data here, but I think that whole piece around how can an individual, particularly if they're not somebody who's employed in this work, really feel like their time is well spent and appreciated and impactful in terms of having come in and given an opinion or offered some other input that, again, is really important to the system. Nothing about us without us, if you will. And I think that's true of direct service providers as well, who may not have as much time to be engaged in meetings like this, but whose voices are incredibly important to what it is that we are trying to do in terms of systems integration, collaboration, and really making sure that we're being fully inclusive as a state. So I really applaud this effort, and I'm glad to be here today. Thank you.
So it's Kaya again. I'm going to build on what Pam said and tie it back to my IDEA comment, which is if we're going to ask people and families or who are not paid to do this work, that they should be reimbursed, and their time matters, and it should be recognized.
Hey, and Pam, you both talked about IDEA. Can you just say, I know that this group is well versed, but just very quickly talk about IDEA for 1 second in the context that you're presenting?
Sure. IDEA stands for Inclusity, Diversity, Equity, and Accessibility. And I use this acronym more than DEI or some of the others because of the piece on accessibility, which I think is extremely important and often overlooked when it comes to marginalized groups or populations. And how do we make sure that they have that seat at the table, their voices are heard, and that we're really looking at, is what we're doing accessible to everyone?
Thank you, Kaya. And the reason I asked that is because I know that when you referenced IDEA and Pam referenced IDEA, those are two different things. Pam's referencing the Individuals with Disabilities Education Act. So I just wanted everybody to have the same starting
Yes, I know.
Thank
It
you,
gets
'cause that was
confusing.
And that's
Yeah.
another place where I think clarity around our acronyms, because we're all really good at it as professionals and kind of understand the cross-referencing. But I think that's going to be important too in terms of initiating new members, if you will.
That's great. Thank you both. And thank you for your thoughts too on parent partnership and leadership work. That's something we're really actively thinking about as part of our grant through HRSA, the VIP3 grant. And how do we ensure that we're engaging families at all points, but also ensuring that engagement is really meaningful and well compensated and all those things. So I appreciate those thoughts. I see both Charlotte and Janet. So I think I saw Charlotte's hand first. So go ahead, Charlotte.
Hey, this is Charlotte. And I could not agree more with everything Pam just said regarding families. I mean, this is sort of my jam around how might we embed family voice across programs. And, again, I think that we need to have specific outcomes and measures to, not only ensure that the family voice that we are embedding, is diverse, but also that we're surveying families before and after, that we have a very clear ask on what we're asking them to do, et cetera, et cetera. So agree that the partnerships with families need to be compensated, but they also need to be absolutely authentic and meaningful. And, I think to some end, I think if, Jen Fortman is incredible. I think there might be a few other families on this team. Having families on this team might help increase the doing.
That's great. Thank you, Charlotte. Janet, do you have something to add as well?
Sorry, I have to unmute. Yeah, I was gonna, I think these are great ideas. I appreciate everybody's input on the family piece. I also think maybe there is a way we can leverage the BBF Families and Communities team and that steering committee to have maybe more regular connection, so to speak, because they're doing such amazing work, and that's also less demand on families if we ask them to come to a separate meeting, but maybe there's some cross ways that we can have combined meetings at times that we leverage their voices more strongly. Also, I didn't put this on the slide before, but one thing I really appreciate about what we're trying to do with the COAT team is leverage it as a key state early childhood leadership team or strategic planning team, a place that we can really get input from all of you and these more cross-sector, wider range of folks to direct multiple state priorities, if you will. So we have the VCAP, but then we're really leveraging this group for 2 federal funding sources currently in early childhood, as well as kind of combine the Help Me Grow strategic planning team with this larger group, sort of instead of having all these separate kind of programs and initiatives have their own steering committees or leadership teams, really trying to leverage the BBF network and this group particularly to help direct a lot of this work. And kind of this year, kind of working to bring in home visiting a little bit more strongly, our McVie HRSA funding, connecting that to the early childhood system. So I'm just really grateful that you all are open to this and that BBF is really more intentionally that we can kind of direct this work in a very large way that helps us meet national requirements, and I know we've been reporting out on that, but there'll be more to share to make us feel like we are doing something in terms of moving towards integration. Thank you.
Janet. Before we transition to Jen, I want to make a connection between something that Janet brought up and that Charlotte and Kaya brought up, which is there's this idea of serving in this strategic way, that this committee is coming together to drive strategy, to drive priorities, but there's also a connection to make with the data, our indicators, our outcomes. What are we trying to do and move forward in this space? And it's a reminder, I think, for this committee to go back and look at the Vermont Early Childhood Action Plan, not just in goal 1, which is, again, the focus, in some ways, the focus of this committee, but because this committee is focused on child and family outcomes, you're going to see those across every other area of that strategic plan and those indicators. And as we're thinking about how we are measuring family leadership, family engagement, how we are partnering, where we're providing those opportunities and what that looks like, that is a critical area that we in the next couple of years have to define. How are we measuring and how are we improving and really elevating that as a critical component of the network? So I say that just to remind us that we do have that strategic plan and the vision laid out, and that is an area that was a gap. The indicators in that area are to be determined. And because we're trying to make that data connection, this group can help facilitate that discussion alongside the Families and Communities Committee. Not only how are we doing it, but how are we monitoring our ability to do it?
That's great. Thank you, Morgan. I'm going to turn it over to Jen, but first just want to make a connection for folks because I don't think I was clear before. BBF has and already has been committed to compensating all the parent leaders who are part of our Families and Communities Committee for their time, both in that committee as well as in meetings like this and when they attend the SAC and any other BBF network meeting. So right now for us, I think we're really at a point where we're thinking more about how do we extend that, how do we diversify that committee and ensure all family voices are included. And really moving into a space where we're thinking about, we're starting to employ some cultural brokers or liaisons who are supporting that work and really moving into that phase of the work, which is exciting. So I just wanted to make that clear. Jen, would love to hear your thoughts on this as well.
Yeah, thank you. I'm really enjoying this rich conversation. And I wanted to thank Charlotte for your comment. One idea I had as we are creating recruitment flyers for the Families and Communities Committee right now, but we could create something very similar for this committee very easily and really kind of differentiating, like as Morgan was saying, that this committee is different than the Families and Communities Committee, and it's around the child outcomes and more the use of data more so than bringing families together in the Families and Communities Committee. But really communicating with families and following through. I hear a lot just around the work that I'm doing around needing to follow through. What happens when parents come to the table and our voices are heard? What happens next? And everybody at this table knows how important and how great that feedback is, but the parents don't always see that. So how can we follow through and bring it back around where parents are truly feeling like their voice is being heard? And this question has been thrown around, but what exactly is the role of families on this committee? And again, just following through with that. So yeah, thank you. And I'm loving this conversation. I'm happy to help kind of recruit parents and do whatever I can to around that.
Great. Thank you so much, Jen. I think your point kind of speaks to this larger need for like everyone, not just parents, but everyone to really feel like something comes of really rich conversations that we have and that there's a next step. So I appreciate that thought. Charlotte, do you want to add one more thing?
Yeah, I just wanted to, Jen, thank you so much. And I wonder if it makes sense almost for this committee or folks in this committee to for there to be some really carved out time to talk about next steps around embedding families in a different way, have Jen be part of that conversation. I'm so curious, to hear from Jen and other families around what is the best platform to communicate back, to loop back. Is it social media? Is it newsletters? Is it emails? I think those are some really important, great questions, great things that Jen brought up, and I think we should have some dedicated time, to discuss it. Thank you so much.
Yeah, thank you. Very much agreed. Funny you should say that, because we're hoping to focus on family partnership during our next month, February COAT meeting. So we'd love to think further about that agenda with both you, Charlotte, and Jen. That's great to make that connection. Okay, given our time left, I'm going to move to the next two. We have two questions remaining, and I would love to kind of just do like a lightning round of both of those, and kind of folks can return to this Jamboard after the meeting and continue to add their thoughts. So it's been such a great conversation, though I hate to cut it off. And folks have started to touch on this a little bit, but would love to hear kind of quickly what topics, projects, or guest presenters the team would like to hear from in the coming months. What has been missing? What content, have we covered well in the past couple of months or year, versus what issue areas related to children's outcomes, health and well-being, et cetera, do we need to make sure we cover? Collaborations with child welfare, that's a great one. Oops. I don't know what happened. Is everyone else just seeing a big yellow blob?
Yeah, you probably accidentally clicked on the title block and deleted it by mistake, but with a little quick misclick, it looks like. Because I'm still showing we're on slide 3.
Yeah. Oh, I think
there you go.
Thank you. All right, children's mental health and well-being. It's an excellent point. Written summaries of info presented above the notes linked in accessible docs. Thank you. I appreciate that. We're made a couple of tweaks to how we've listed like past resources and notes in this month's agenda, but would love, if folks have other thoughts about how to do that type of thing better to make things more accessible. Okay.
Anna, can I quickly expand on that one? Because that's mine.
Absolutely, please.
So my thought around that is like, we have these really great presentations, but I'm thinking like, if we go back to what do we do with it? What's the ask? I would love to like have those materials to take them back to my appropriate teams.
Yeah.
Outside kind of the note capturing.
Yes, that's a great point, Becca. Thank you.
It's also a really interesting a note for the BBF team to think about how we are being intentional, not just about what we're sharing, but how we are articulating and empowering you all as partners within this network to then take what happens in the meeting and do, right? We recognize and we know internally all of the different ways that we are then taking that information, summarizing it, elevating it across the board to a range of different decision makers and leaders. You all don't see that. We also don't know how you then take that information or take that one concrete piece of data and then use it. So that's something that we should talk about as teams. How do we both make sure that we know what are those critical pieces that we should be taking away, how to use them, just like we did with that, the most recent State Advisory Council and State of Vermont's children work with recommendations. Okay, these are the recommendations. This is how the State Advisory Council uses it. How should you think about using these recommendations? The same thing, the same frame for how we take away what's happening within these meetings. And how are we then serving as ambassadors in our own sectors for this work?
Absolutely. Thank you both. All right, I'm going to jump on. These are all great ideas. Folks can feel free to continue to add to them both now and after this meeting. But I'm going to jump on to our final question, which is, and we alluded to this earlier, but are there any key voices or partners based on Coach Charge that you feel are missing from the table on a regular basis? So this could, you could name drop, but also certainly like specific or organizations or bodies of the work that that you feel are not part of the group. Family services. I'll give folks another minute or so. I imagine folks are typing. Pediatricians and members from the healthcare community. That's a great point, and something that we're thinking really strategically about within the HRSA grant that I mentioned earlier. Healthcare. Data analyst, a lot of healthcare hits. It's a good reoccurring theme. Okay. Since we promised to end the meeting a little bit earlier this morning, I'm gonna kind of pivot away from this, but legislators, that's a great point. But really appreciate everyone's thinking on all of these questions, and this is really, really helpful, as Morgan has said, for our team when we think about how to better support this committee and all of BBF committees in the really important work that they're doing. So I'm going to stop this share and I'm going to start a new one, and I'm going to hand things over to Dora and guest Monty to talk a little bit about State of Vermont's children.
Thanks, Anna. And Monty is just about to fall asleep, but we'll see how that goes. Can everybody hear me well enough? All right, I lost okay, perfect. Thank you. And I'm happy to be here, and I love this team. I think it's such a great and engaged group. I, again, am a research and data director, and I live down in Dummerston near Brattleboro. So to Pam's point, I'm in another part of the state than most of you. There is a lot of information in this State of Vermont's children, and the full briefing and information about the early childhood landscape, recommendations, health-specific data is all on our website. And Beth, maybe if you could, or if Anna or Beth can put that in the chat, that would be great. I do want this to be a conversation, so stop me if there are questions. I know that a lot of you have more expertise in these areas than I do. So please add context or bring up conversations, bring up points. BBF is mandated to provide a report on the state of Vermont's children to the governor and legislature at the beginning of each session. However, this has become a report that is really meant to meet the needs of all stakeholders. And we hear often that it's used for grants, that it's used throughout the year to provide context and to bolster requests for additional funding, to highlight different areas across the state. And we also have these regional profiles for all 12 regions. That's half of the report is dedicated to the regional sections. It is not necessarily sharing new information, and it is providing quantitative data to back up sort of the on-the-ground experience. Oftentimes, especially during COVID, we are not able to tell the why, but really only the what. And we have these recommendations, many of which came through this COAT team, and those, even without knowing the whole experience and the why, the recommendations can still be implemented. Today, I thought that we would focus a little bit on the social determinants of health and regional variation. And just thinking, sorry, I'm just making sure that I'm talking about the right thing that's on the slide. When we look at what it takes for a child to be able to thrive, to get to those positive outcomes, we think a lot about these social determinants of health. And two that have significant regional variation are food security and the number and the percent of children living in households with incomes below the 200% of the federal poverty level. So when we look at children living in food insecure households, Vermont is at 14%, but there are some counties, Grand Isle is at 11%, and Essex County is almost at 20%. And again, we had a great experience where there was a legislator who was able to use this information along with the story of people on the ground being food insecure to be able to get additional funding for that food bank. So really powerful. The Vermont statistic is really helpful, but it's so important to recognize that even in our small state, people are having a lot of very different experiences. And that's especially true for children, and the impact on those children can be pretty significant. When we look at children living in households with incomes below 200% of the federal poverty level, again, Vermont is at 36%. Franklin and Grand Isle, the region and AHS district is at 25%. And then again, Caledonia and Southern Essex is at almost 50%. And the reason we use 200%, hopefully next year we'll get to 185%, but that is the benchmark for a lot of federal nutrition, federal benefit programs. Any questions before I move on to some health specific data?
Dora, this is Cynthia. I don't really have a question, but I just wanted to add right here in this section, these numbers are super helpful, but I do want to call out that it's 2019 data, and we know that actually a report was just released in November saying as many as 1 in 3 or it's more than 1 in 4 children live in food insecure households currently during the pandemic. And I think we also know that the contributing factors that can make that, an even more dire number, if you will, are single-headed, what am I trying to say? Female heads of households, single parent households, there we go. And then of course, people of color. And so I think, when we're really talking about early childhood, one of the data pieces, you've heard me say this before, that's really challenging about looking at food insecurity is that we can't actually get data for 8 and under or 5 and under, that this is whole population up to age 18, and that greatly impacts I think what we could look at for early childhood. So one of the solutions, just a quick FYI, the Farm to Early Childhood Coalition has just engaged with Nemours to do a springboard opportunity where we are going to do geographic information mapping of CACFP, food deserts, poverty levels, so this kind of data. It'll be an interactive map so we can see where those deserts are, what the poverty levels are, where CACFP is and is not. And we're going to also layer on our childcare system, so registered and licensed childcare and their quality rating. So we hope that project will be completed by July or August of this year, and it should actually give us visual as well as some narrative and policy talking points. So more to come.
That's awesome. And I would love to connect with you more about that and to think about making sure that I know that there are some other maps. And so making sure that, again, we're using common definitions and that we're really sharing the same information and leveraging our resources. So exciting and important. And absolutely, this is 2019 data. It's along with a lot of these things, it's making, everything has been exacerbated because of the pandemic, and we can see even beforehand these were not insignificant problems, right, and challenges. So I wonder if we can move on to the next slide, and this is really, again, older information. But looking at regional variation across both immunizations and developmental screening. For immunizations, this is for children who are receiving all of their scheduled immunizations by age 2 or 3. I'm sorry, I don't have it right in front of me. I definitely should. Apologies, and probably some of you know. But we have a great 76% across Vermont, but in Essex, it's at 58%, and then Rutland is at 81%. So again, thinking about what are the various factors, all sorts of implications, and also messaging, right? When we're talking about sharing resources in this group, what is going to resonate? Are there places that need more of a focus? Are there places where maybe we don't need to spend as much? Like it's not necessarily equity in promotion of resources, and what is resonating may not be sharing everything equally across the state. In terms of developmental screening, I just want to point out that this is based on claims data, and this is not, so there's been a great push by from Help Me Grow and Let's Grow Kids to really have childcare programs do developmental screenings, and those would not be captured here because this is based on medical claims data. However, even based on this medical claims data, we can see that there's a huge discrepancy, and maybe there's some of this that is about data and who's putting in the claims, and whether this is just a billing issue or whether it really is a difference in children accessing these developmental screenings, and potentially what that means for early identification and early intervention, and being able to address those delays. Becca, do you have something to add? Okay. So I really, this report has so much information, and these are just 4 really small spotlights talking about the regional variation. And it's probably not a report that you're going to look at, that you're going to read cover to cover. And but it is something that can be referenced throughout the year, and again over time. And great point. I think so much of what we've tried to show this year. Last year we had our data spotlight was on the impact on what we knew about COVID-19 data. This year we embedded it a little bit more, but again, as we're trying to make sure that we are reporting high quality data, there is a lot that we still don't know. And it often takes a year or 2 years or 2.5 years to be able to have this high quality data. And we want to make sure that what we're reporting is accurate. And these are things that we are monitoring over time. Okay, testimony today on childcare and pre-K settings. Sorry, I'm missing some of the things that are in the chat. So anybody who wants to jump in with questions. Morgan, am I missing anything?
No, I think this is an incredible discussion. I think you did a phenomenal job describing the data. And I think, we want to continue to make not just this report incredibly powerful and useful, but we want to have deep discussions about what data might be missing and how to make that publicly available. So having these discussions with this group is really helpful because you're identifying areas where we have the opportunity to centralize more data, right? That's one of the things that is not currently done in the state of Vermont. There's no beautifully integrated data system that lives within the state that integrates all of these sources of data behind the scenes that we can then pull and make publicly available. So what we're focused on in these last couple of years is developing concrete partnership and relationships with all of our agency leaders across departments, divisions, and private sectors to say, what data do we have that tells us the most important information about the current status of the well-being of kids and families? And then we centralize that data. We put it out in the form of this report, but also through Vermont's Early Childhood Data and Policy Center at vermontkidsdata.org. And for right now, we rely on all of you as concrete partners to say, here's what data is missing. Have you thought about this to really make this robust?
Janet, do you want to add something?
Sure. Oh, here's Lauren making a comment. Exactly. Yeah, this is such a powerful slide. Thank you so much. I love this. And we'll share it with our VCHIP partners, Vermont Child Health Improvement Program, who help us with our child health provider outreach and quality improvement around developmental screening. And I know we've been working hard to get more childcare provider screening up in Newport. And we are so looking forward to when we can use the registry, our developmental screening registry data, because that is an integrated data source. We will pull in anybody who's using the ASQ online system, any community partner, childcare provider, or physician practice. All that data will go into the registry, and our IT got pulled off. We're almost done before COVID, and they got pulled off to help with COVID. So we're just waiting. Hopefully we can use it for next year's However Vermont's Young Children report. So, but this is the best we have to go on, and we really do need to focus in on those. Newport, Bennington has, we do have some partner Head Start, Early Head Start, doing some screening down there, which would not be captured in this data because again, it's through ASQ online. But we have, did I say we have over 7,000 screens now in that system just from this past year and a half. So when that gets into the registry, these percents may very well change.
Thank you for that context, Janet, and for all the work that you are continuing to do and that the team is continuing to do, even as everyone has been redeployed to COVID response. Renee?
Yeah, thanks, Dora. And as always, great job on this data. I find it fascinating. And at the same time, I'm thinking about what members of this group were talking about earlier in terms of those calls to action, right? And like, what do we do with it? And as much as I'm excited to hear, there's more updated data and we're mapping things, that's great. I am wondering, like, okay, how does this group support action? And whether it's identifying, like, for me, the food insecure slide, really jumped out at me and made me think, like, okay, so how can this group kind of call what's working well in other areas? Like, can we look at areas in the state that have lower rates and figure out what's happening there, and if we can do anything to scale, or what are some of the national best practice strategies, and so just trying to think, like, how can we now use this data to do what this group, it seems like, wanted to do, which is move to action, is like, okay, this is not acceptable. Identifying who are the stakeholders in this, what are some strategies that work, and then how can we leverage our networks to actually implement some actions to move this curve in the right direction. So I will leave it there, and I apologize, I do have to hop off for a 10 a.m., but this has been a great meeting. Thanks to the BBF team for convening, and again, Dora, kudos for you and the work on this data. This is really powerful, and I'm excited, as always, to get to that point of, like, what are we going to do next? How can we keep things moving in the right direction? So nice to be with you all this morning, and I hope you have a great rest of your day.
Absolutely. Thank you so much, Renee, for that point, and circling back to what we were talking about earlier, and so much of what was coming through on the Jam boards about next steps. I was just glancing through the recommendations, and we don't have something right now that is directly looking and could connect to the food security that is really on these direct outcomes and addressing basic needs. And I want to remind people, Beth did a great job in the early learning and development VCAP committee, that this group has the opportunity to put together recommendations outside of the traditional SAC recommendation cycle. So if there is a recommendation that we want to pull together as a team, that there is a focus area for something that needs to be addressed, and there is a consensus about what that would look like, that is something that this group can come together as this really strong cross-sector group. And again, if this is a direction, just a reminder that is an opportunity for this group.
And that we are piloting that this year, right? So this is not something that we had done in previous years. Generally, we run on a SAC and a VCAP cycle and annual SAC recommendations, but we want to try this year being more responsive and adaptive to the urgent needs and priorities. And we are looking to our VCAP committees as the leaders who can help identify what those are, and then bring those again right up to the SAC as an opportunity for formal adoption outside of that cycle. So we're also excited about that and looking for your feedback on how that works this year.
I just want to say thank you for this opportunity. And if you have any questions, if there are any errors that you're finding, please don't hesitate to reach out. And if you have information that should be put on Vermont Kids data, we can absolutely put on publications. If there's data that you want to share, it would be great to have, again, this most up-to-date information. And I know that you all are the experts and the data stewards. So thank you.
Wonderful. Thank you, Dora. Really appreciate you sharing that update with everybody. All right. And apologies to folks for going over. Totally understand if folks have to jump off, but we are going to kind of conclude here with sharing a little bit, as I mentioned at the top, about how BBF is tracking essential considerations in the field right now and how we're elevating any potential concerns, considerations, etc. So I'm going to ask Beth to give a brief update about that. And then we would love to hear from folks about what kind of sticks out to you during this time, things that you're tracking in the legislature, other priorities or projects that you'd like to elevate with our time left. So Beth, I'll hand it over to you.
Yeah, thank you. Really quickly, one of VBF's charges is to engage our network to be able to monitor and elevate gaps and needs that are happening for, impacting children and families and elevating those to policymakers. And a new tool that we are trying out is being able to capture emerging priorities and capture them into a spreadsheet and then communicate them regularly to a set group of agency leaders so that they're aware what's going on, and in certain cases able to respond, in other cases use those situations to be able to inform changes to policy or resource allocation. So we are developing this tool and capturing situations that are happening both through VCAP committees, through our regional councils, and sharing those with agency partners. So just want to let you know that that is happening, and invite you to be able to share situations that otherwise are not getting the attended to in a way that we think the system should. And it's a way to elevate and inform.
Great. Thank you, Beth. Does anyone have questions about that process? Okay. Well, certainly know it's something that we're doing, and we're happy, to elevate things that you're hearing about. So please be in touch. And looking at the time, again, if folks have things to share in terms of projects or updates, happy to hear them, but also understand if folks have to jump off. As Michelle, I think, mentioned earlier in the chat, there is testimony happening at 10:15 in-house human services that will kind of be monitoring related to childcare and pre-K, and the impacts of COVID-19 and current, policies around COVID. Is there anything else folks want to elevate during this time?
Anna, it's Cynthia. Just so folks are aware, the week of February 7th, we're going to be highlighting food insecurity, farm to early childhood, the local purchasing incentive, and universal school meals during that week. So if there's a little outreach to folks or folks are interested in that type of information, we can share it with a broader audience. So it's coming right up.
That's great. Thank you, Cynthia. Anyone else before we wrap things up for the month?
I just wanted to mention that they're taking public testimony on the budget next week on the evening of the 8th and on afternoon of the 9th. Signups are going fast, so if folks would like to speak up or have someone who wants to speak to a particular issue around this, do that. It would be really important. So just want to put that opportunity out there. And also wanted to note that we as the state are pursuing the Statewide Family Engagement Center grant. That could be as much as $750,000 a year for 5 years. And Parent-Child Center Network is taking the lead on the proposal. And we've been diligently working on that because it's due on the 17th of February at midnight. So just wanted to note that. And hopefully members of this group, like Amy, will be coming back and telling you, yes, we were successful and we're going to charge forward with this. So a lot of what we've talked about in the code and in the family and community engagement group is being fed into this, as is the ECAP and the other work that we've done. So I just wanted to say kudos for that. And last but not least, I will be exiting my role at Vermont Family Network on February 25th. So if we're not meeting again before then, I will bid you a fond farewell and hopefully cross paths with you again sometime in the future. So thanks.
Wonderful. Thank you so much, Pam, for both of those announcements, and congratulations on your transition. I know we haven't worked together long, but really appreciate and value your participation in this group and others. So thank you, and you'll certainly be missed. Jen, would you like to share something?
Yes, sorry, my kids are kind of all over the place. Couple things. that I've been hearing. There's a new homeschool bill that is coming out that I've just heard some word about, so just kind of wanting to bring that to your attention. I'm trying to find my notes about what bill exactly that is, and I can't find it off the top of my desk. But in addition to that, the Families and Communities Committee is in the very early stages of conducting an additional family engagement assessment. And so if there's any topics that you all would like us to include in that survey, I would love to hear from you. Again, we're just in the very early stages. We're going to review the initial survey and make edits to that. So feel free to reach out to me if you have any topics or questions that you feel should be in that survey.
That's great. Thank you, Jen. And thank you for pointing out that bill. I'll certainly look into that. All right. Thank you all so much for your time. Really appreciate everyone's extended time this morning, and hopefully we're at least gifting people a little bit of time back in their normally scheduled Thursday mornings. So I hope everyone has a great month. As I said, please feel free to pop back into that Jamboard if you have other thoughts to share, and we'll kind of curate, collect everything that's been shared there. So thank you. Great to see everybody.